You don't usually see a patient who's had cancer so early in their life. Something that looked almost like a pimple or just a red spot on the skin, it turned out to be something that was trying to kill her.
Any sort of physical activity outside, I have a connection to. I started playing tennis when I was about 9 years old. I was in the USTA world and doing tournaments, tennis constantly. And then in college, I had this small spot on my face, but I never thought twice about it. I wasn't really conscientious of it. And then it never really went away. I was like, I need to go get this checked out. I had the biopsy done. I got a phone call a week later. It was a basal cell carcinoma. My heart sank. You know, that was like my immediate gut reaction. My heart just sank.
In this case, we had a skin cancer sort of straddled the cheek and the eyelid. And I think the face plays into a person's identity. It's such a big role in who we are and how we interact with the world. And so with Miller, one of my goals was to make sure that we had all the contouring in the way that when she moves and animates her face, that it would look just like she used to look.
When you're outside playing tennis, everything needs to be covered with sunscreen if it's not covered with a physical barrier like clothing, because this is not worth it. There's
no age where it's too early to start. We see these things happening, unfortunately, earlier than they used to, and we know that there are multiple factors, but we always thought that the biggest factor was cumulative sun damage.
It's sexy to wear sunscreen. It's cool when you can see your sunscreen, like you know you're being responsible. You're like, oh, that person's responsible. That person knows what they're doing.
I think it's just really important to be vigilant. If something were to happen, to just make sure you get checked. We know our body's best, so be in tune with your body and understand what it looks like, what it acts like, and react to that.